Hello and welcome. My name is Dr. Craig Burko. This is another ACOM Health Tools for Success presentation. Today's topic, a very important topic, is the subject of workflow issues in the chiropractic practice. Something I've always been aware of as a practitioner of 20 plus years. This is certainly an issue that can affect your cash flow and your bottom line. Today's Tools for Success we'll be discussing, is this a problem happening in my practice? What are some of the causes of this important issue, how to fix it, and how can technology help? Is it happening in your practice? There are a few things that you can do to find out if it's happening in your practice. Number one, check your cash flow and revenue. Often there is a correlation between the results of these reports and if there's a workflow efficiency issue in your office. I do want to first share that workflow efficiency issues can happen in one or more of several areas within the practice. And from my experience, when it happens in one area, in all likelihood it affects the other areas too. What are those areas? There could be a workflow efficiency issue at the front desk, at the back desk, and or even with the provider. Again, if I'm hopeful that you're receiving daily and weekly, monthly, or quarterly reports on your patient visit average or your missed visit average or your total patient visits. I'm hoping you're receiving reports about referrals. I'm hoping you're receiving reports on cash flow. And the reason I'm sharing with you this is when there is a workflow efficiency issue, front desk, back desk, or even with the doctor, it absolutely is showing. It can be seen in these reports, especially in your cash flow reports. And even receiving something as simple as patient referrals from existing patients. If that metric is down, if the number of referring patients is down, there may be even a workflow issue in how your front desk or how even you as the chiropractor communicate effectively to your patients. Do you even have enough time to communicate with your patients? That's a workflow issue by itself. So what can be causing a workflow issue? There could be inadequate front desk procedures. Those front desk procedures could be anything from scheduling new patients to patient intake and getting accurate patient data at the front desk. It could be something as simple as referring a patient for an MRI or CAT scan, or even something as simple as collation of the patient chart, creating the patient chart in preparation for the patient to see the chiropractor. There can be back desk workflow issues as well. The back desk is often responsible for the billing. Is the billing getting out on time? Is there accurate data being submitted from the back desk to the insurance company? There could be a number of back desk procedural issues. The provider, there could be workflow inefficiencies for the provider as well. For example, does the provider have enough time to communicate with the patient, to explain what the cause and why they're coming in? Does the chiropractor have enough time to share about that this is a referral practice and we're appreciative that you would send your friends, family, or coworkers? Does the chiropractor have enough time to do their encounter notes during the visit or that same day? There could be a workflow issue there. And some of the, certainly an issue is staff time. Does the staff have the appropriate cycles and staff time to even perform necessary workflow to get the job done? And even more importantly, does your front desk, does your back desk, even the chiropractor, does the chiropractor have the proper tools, such as the tools to schedule patients, the tools to do the encounter notes, the tools to do billing? How do we fix these issues? Certainly tracking reports regarding cash flow, regarding revenue, regarding your total patient visits, missed visit averages. Those are all very, very important. I found in my 20 plus years of practice, patient satisfaction surveys and patient comments are a great way to tell if there's workflow issues in the practice. And a big way that I learned was switch place with a patient. Become a patient. Have your staff become a patient, and then get feedback, and immediately you'll be able to discover if there is a workflow problem or not. I will tell you, in all sincerity, automated systems can better manage a practice. There's no practice management expert that would disagree with the issue. That doesn't mean that automated software and practice technology is the sole answer for your workflow issues. But from my experience, automation software can definitely help better manage a practice, especially in reducing the amount of admin time necessary to perform vital tasks like at the front desk with scheduling and collecting patient intake, as well as the back desk in getting the billing out. Certainly technology, when you have technology that can better communicate with patients, those patients are happier patients, they're more satisfied, and they certainly refer more. Automated technology, in my opinion, and from my practice experience, create a happier patient, a happier staff, and a happier provider. Technology has the ability to help a chiropractic practice. ACOM Health has many chiropractors on staff that can listen and hear about your practice challenges, including this very, very important one on workflow. Give us a call, 866-286-5315. We'll be glad to listen and hear about your workflow issues and see if we can share with you some better best practices to correct and improve those workflow issues. We invite you to call us at 866-286-5315. Have a wonderful and successful day, and thank you so much.